What if a really common childhood thing, like swollen cheeks, was actually a warning sign for something much more serious? Today, we're going to dig into a medical case that shows exactly why doctors sometimes have to look way beyond the obvious symptoms.
Okay, so our story kicks off with a pretty mysterious medical puzzle.
So, picture this. We have an 8-year-old girl, and she keeps getting this painful swelling in her cheeks, right around her main salivary glands. And this isn't just a one and done thing. Nope, it has happened 4 separate times in just the last year.
Now, the doctors, they've tried the usual playbook, steroids, antibiotics, but the swelling just keeps coming back. So the big question is, what's really going on here? What are they missing? To crack this case, we have to start with the basics, line up the usual suspects. What typically causes this kind of swelling? The official term for what she has is parotitis. It's really just a straightforward inflammation of those parotid salivary glands. And yeah, most of the time, it's caused by a pretty simple infection.
Generally, parotitis comes in 2 main flavors. On one hand, you've got the viral kind, like mumps, super common in kids, and you pretty much just treat the symptoms. Rest, fluids, that sort of thing. But on the other hand, you have the bacterial form. It's way rarer, much more severe, and often lands you in the hospital with IV antibiotics. So 2 totally different worlds. But here's the thing. Neither of those really fits our patient's story. I mean, a typical infection comes, you treat it, and it goes away. This keeps coming back. That tells us we're probably looking at the wrong diagnosis entirely.
And that little detail brings us to the real culprit in this whole medical mystery. There's a condition known as Juvenile Recurrent Parotitis, or JRP for short. And its defining feature, you guessed it, these exact cycles of inflammation and then getting better that our patient is going through. So, what does JRP look like? Well, it usually starts when kids are really young, and for some reason, it's more common in boys. The good news is, it tends to just go away on its own once they hit puberty. But the big question mark, what actually causes it, is still a bit of a mystery. But JRP isn't just some simple, annoying, recurring infection. Nope. This is where the story takes a really critical turn. And here it is, the key insight from the medical research. JRP isn't always just JRP. It can be what's called a sentinel sign. Think of it like a warning flare, an early signal that something else, something much bigger and system-wide is happening in the body. And this isn't just some wild theory. The numbers really back this up. A study looking back at old cases found a pretty shocking connection. For a huge chunk of JRP patients, that swelling in their cheeks was just the tip of the iceberg. How shocking! Well, a full 44% of the JRP patients in one study had some kind of underlying immunological issue. And we're not talking about small stuff here. We're talking about serious autoimmune conditions like Sjogren's syndrome, lupus, even celiac disease. That changes everything. So, knowing about this critical link, how did the doctors change their approach with our 8-year-old patient? Well, they knew they couldn't just treat the swelling and send her home anymore. The game had changed. They had to launch a full-blown investigation to see if her JRP was that sentinel sign, that warning flare for something else. And that meant a complete diagnostic workup. They started with the basic blood work, of course, but then they had to dig way deeper. They started hunting for specific autoantibodies that point to diseases like Sjogren's and lupus, and they even screened for a whole list of other chronic conditions. So after all of that, what are the big takeaways? What's the bottom line from this whole medical mystery? The story of this 8-year-old girl really teaches us a huge lesson. A single case of swollen glands might be common, sure, but when it keeps happening over and over again, that's a massive red flag. A diagnosis of JRGP should be an immediate trigger to start searching for a deeper underlying cause, which, as we've seen, is often an issue with the immune system. And that really leaves you with a final thought, doesn't it? How many other really common, seemingly simple symptoms that we might just brush off are actually early warnings for something much more complex, just waiting for us to connect the dots?